podcast episode, Chest Wall and Pleura. Welcome back to Radiology Made Easy, your go-to podcast for breaking down complex radiology topics into easy, digestible bits. Today, we're diving into the chest wall and pleura, focusing on rib lesions and clavicular issues. There's a lot to cover, so let's get started. First up, let's talk about rib lesions. They can range from benign to aggressive, and it's crucial to know the difference. Starting with the benign side, we have congenital abnormalities. These include variations like bifid, splayed, or hypoplastic ribs, which can sometimes be associated with syndromes like basal cell nevus syndrome. One interesting example is the cervical rib, which is an extra rib that can cause thoracic outlet syndrome. This condition can be quite a surprise on imaging, especially since it affects about 1 to 2% of the population. Moving on to more routine findings, we have post-fracture callus formation, which can mimic intrapulmonary opacities on imaging. It's like your body's way of saying, hey, I'm healing here, but in a way that might confuse you at first glance. Then there's rib notching, often caused by external pressure on the rib. This can happen in conditions like coarctation of the aorta or neurofibromatosis type 1. You'll typically see this as an indentation on the lower ribs. On the benign tumor front, we have conditions like chondromas and osteochondromas. These are cartilaginous tumors that usually hang out in the anterior part of the rib. They might show some calcification, which can be a useful clue on imaging. But not all rib lesions are benign. Some can be quite aggressive. For instance, destructive rib lesions are often the result of osteomyelitis or neoplastic diseases. Osteomyelitis is an infection that can spread to the bone, and it can be caused by various bacteria, including staph and tuberculosis. When you see a rib lesion, you always have to consider the possibility of malignancy. Malignant rib tumors are typically metastatic, meaning they spread from other parts of the body, like the breast or prostate. Primary rib malignancies, like chondrosarcoma, are rarer but can occur. Now let's switch gears and talk about clavicles, those slender bones connecting the sternum to the shoulders. These guys might seem small, but they play a big role in your body's mechanics. The joints at both ends of the clavicle are synovial, which means they have a fluid-filled cavity that can be prone to inflammation or erosion, especially in conditions like rheumatoid arthritis or hyperparathyroidism. One pearl to remember: when you spot a lesion on the clavicle, it's often bad news. Clavicular neoplasms are usually malignant, often due to myeloma or metastasis. But there are other primary tumors and tumor-like conditions to consider, such as osteosarcoma, Ewing sarcoma, post-radiation sarcoma, aneurysmal bone cysts, and even conditions like histiocytosis X and intersternocostoclavicular hyperostosis. All right, let's wrap this up with some key takeaways. Rib lesions can range from benign congenital anomalies to aggressive conditions like osteomyelitis and malignancies. Benign rib lesions include callus formation post-fracture and tumors like chondromas. Rib notching often points to systemic conditions like coarctation of the aorta or neurofibromatosis. When it comes to the clavicles, be cautious with lesions as they are frequently malignant. Always consider the possibility of primary or secondary malignancies. That's all for today's episode on chest wall and pleura issues, focusing on rib and clavicular lesions. I hope you found it both informative and engaging. Thanks for tuning in to Radiology Made Easy, where we make complex radiology simple. Stay curious and keep learning, and we'll catch you in the next episode.